Tips for approaching NBCOT practice questions and sample rationales. The National Board for Certification in Occupational Therapy, NBCOT, is a nonprofit organization that offers certification for occupational therapy professionals in the United States. NBCOT provides certification exams for both occupational therapists and occupational therapy assistants to assess their competency in their respective roles. This certification is required by state licensing boards and employers, demonstrating a professional's commitment to maintaining a high level of competence in their field and enhancing job prospects and career advancement opportunities. The NBCOT certification exam typically consists of multiple-choice questions that cover a wide range of topics related to occupational therapy practice. While we cannot provide access to current NBCOT actual practice questions and their rationales, we offer some general tips on how to approach practice questions and understand their rationales. It is important to read the question carefully and understand what type of answer is required. Eliminate irrelevant information and identify what is relevant. Consider all answer choices, as there may be more than one correct or partially correct answer. After selecting an answer, review the rationale to understand why it is correct or incorrect. This helps in learning from mistakes and reinforcing the understanding of the material. Identifying knowledge gaps while practicing can be used as an opportunity to study more in those areas. Now let's take a look at some sample NBCOT practice questions along with rationales. 1. Which of the following is a characteristic of a sensory integration disorder? A. Difficulty with fine motor skills. B. Difficulty with gross motor skills. C. Difficulty with attention and concentration. D. Difficulty with social skills. Answer. C. Difficulty with attention and concentration. Rationale. Sensory integration disorder is a condition where the brain has difficulty processing information from the senses. A common symptom of this disorder is difficulty with attention and concentration, as the individual may become easily distracted by sensory stimuli. While fine and gross motor skills may also be affected, they are not the primary characteristic of this disorder. 2. Which of the following is an appropriate intervention for a client with a traumatic brain injury who is experiencing memory deficits? A. Encouraging the client to use memory aids, such as a smartphone or notepad. B. Providing the client with repeated verbal reminders throughout the day. C. Limiting the client's exposure to new information to avoid overstimulation. D. Providing the client with opportunities for rest breaks throughout the day. Answer. A. Encouraging the client to use memory aids, such as a smartphone or notepad. Rationale. Memory deficits are a common symptom of traumatic brain injury. One effective intervention for this is to encourage the use of memory aids, such as a smartphone or notepad. This allows the client to compensate for their deficits and improve their ability to remember important information. Providing verbal reminders may also be helpful, but it is not as effective as memory aids. Limiting exposure to new information or providing rest breaks does not address the underlying memory deficits. 3. A client with rheumatoid arthritis is experiencing pain and stiffness in their hands. Which of the following interventions would be most appropriate for this client? A. Providing the client with a weighted blanket to decrease joint pain. B. Recommending the use of heat or cold therapy to reduce pain and stiffness. C. Encouraging the client to perform hand exercises to improve range of motion. D. Providing the client with a wrist splint to immobilize the joint and reduce pain. Answer. D. Providing the client with a wrist splint to immobilize the joint and reduce pain. Rationale. Rheumatoid arthritis is a condition that causes joint pain and stiffness. One effective intervention for this is to provide the client with a wrist splint to immobilize the joint and reduce pain. Weighted blankets and heat or cold therapy may be helpful for other conditions, but they are not as effective for rheumatoid arthritis. Hand exercises may be helpful for improving range of motion, but they may also exacerbate pain and should be used with caution. 4. Which of the following is an example of an environmental modification that could improve a client's independence in their home? A. Providing adaptive equipment for bathing. B. Developing a home exercise program. C. Teaching energy conservation techniques. D. Installing grab bars in the shower. Correct answer. D. Installing grab bars in the shower. This modification could help prevent falls and improve the client's ability to perform self-care tasks independently. 5. A client with Parkinson's disease is having difficulty with fine motor tasks. Which of the following strategies would be most appropriate for addressing this issue? A. Providing a hand exerciser to improve grip strength. B. Teaching the client to use adaptive equipment for self-care tasks. C. Recommending weight-bearing exercises to improve overall motor function. D. Incorporating task-specific training to improve hand dexterity. Correct answer. D. Incorporating task-specific training to improve hand dexterity. This approach focuses on practicing the specific tasks that the client is having difficulty with, rather than simply strengthening the muscles involved. 6. A client with a traumatic brain injury is having difficulty with memory and executive function. Which of the following interventions would be most appropriate for addressing these issues? A. Providing a memory aid, such as a written schedule or reminder system. B. Recommending sensory integration therapy to address underlying sensory deficits. C. Teaching relaxation techniques to reduce stress and improve cognitive function. D. Incorporating graded activity programs to gradually improve cognitive function. Correct answer. A. Providing a memory aid, such as a written schedule or reminder system. This approach provides external support to help the client compensate for their deficits and improve their ability to manage daily tasks and routines. To improve your chances of passing the NBCOT exam, it is recommended that you consult the official NBCOT study materials for the most accurate and up-to-date information. The NBCOT website offers a variety of resources to help you prepare for the exam, including study guides, online courses, and practice exams. Additionally, the NBCOT provides a detailed content outline for each certification exam, which includes the domains and tasks that will be covered. This outline can be used as a guide to ensure that you are familiar with all the relevant topics. When practicing with sample questions, it is important to not only focus on getting the correct answer but also to review the rationale behind the answer. Understanding the underlying principles and concepts will better prepare you for the actual exam. Good luck! Thanks for watching Vlogger's Corner.